Thank you ever so much for the invitation, Kieran and colleagues. I'm really pleased to be here and to have the chance to have what was billed as a fireside chat with Annette, who's already complained to Kieran that there doesn't seem to be a fire, although she's pointed out a red light down here, which may...
I'm very literal.
Yeah,
Yes.
as you'll find out in a minute. So my role, I think, is to introduce Annette and then ask her questions which tap into her extensive knowledge of using evidence in policy and practice. Annette has a slightly different version of this where we have a conversation and I have to say things as well, and we'll see who wins that little tussle. So Annette and I think, I'm not sure the exact date, but it was late 1990s.
When I was still a child.
I was going to say when Annette was 10 and I was 13, and we were working together at Warwick University in a research centre, actually, which on reflection probably was ahead of its time, nothing to do with me, but we were researching things like how do public bodies work together in partnership to combat social exclusion and poverty, and co-producing that work with a consortium of 40 local authorities from across the UK. And yes, there was one from Wales, Torfaen. Meanwhile, Annette was working on an equally topical topic around the implications of an ageing society right back in the late 1990s on a programme which I think was called Better Government for Older People. And we were also researching with these local authorities the UK's relationship with Europe. So that's the only one that hasn't stood the test of time, but the others actually were remarkably prescient. Annette has gone on to much greater and important things since then, and I think I can fairly say, without any hyperbole, she's one of our leading experts on evidence use in policy and practice. She was part of the SRC Centre on Evidence-Based Policy and Practice. She was a co-author of the book What Works Now, which updated the classic What Works book, I think nearly 20 years on. What Works by then having become a mantra, the What Works movement, the What Works centres and network, and all of that. And more recently, Annette's been working with the UK Government Office for Science, heading up something called Transforming Evidence, of which you might say a bit more in a moment. And last, and probably least, she's a member of the advisory group for the Wales Centre for Public Policy, which is the organisation that I help to lead. So I was going to give Annette that inadequate introduction as a way of then saying, Annette, tell us a bit about what you've done since 1998, when we were at Warwick together.
As children.
As children.
Yes.
And kind of why this lifelong obsession with evidence use in policy and practice.
Yeah, and I thought I might share like a few light bulb moments along the way, if that's okay, because what's kept me interested in this area and what got me interested in the first place was, I guess, starting out, my original degree was in political science, so I definitely came into doing research with a strong sense of conspiracy theories, so that, you know, nobody wanted to use research and this was all just something we did on the side. And the Better Government for Older People work that the Cabinet Office led, that Steve mentioned, back at the end of the 90s, was about trying to set a government agenda around the future of an increasingly ageing society and to think about that as a very positive thing. And one of my first kind of light bulb moments about this work was, you know, we had this lovely, really old-fashioned civil servant from the Cabinet Office, and we did all our research reports and we shared them with him, and he was like, nobody is ever going to read this. But actually the members of the public we worked with throughout the project read the report and annotated it and engaged with us in it. And actually what he meant was he wasn't going to read it. And that issue about who the stakeholders are for the work you do is really important. Like it's a very wide group of people, and you can never know who it is that engages with research who's going to be the person that makes it make a difference. Actually, the older people's group that worked with us on Better Government for Older People stayed together for the next 20 years and were very influential in policy. So from there, I had an opportunity to go into the UK Department of Health, where I spent a year as a very, very bad administrator. And one of the things that happened to me there in my pursuit of conspiracy theory was finding a colleague of mine's research in a filing cabinet. It's like the Hitchhiker's Guide to the Galaxy. In the bottom of a filing cabinet, a pile of his reports that he'd submitted to the department with the cover, remember compliment slips? A compliment slip on the top, that I just got lost. They were just lost. And not hidden away on purpose, but just that it made me think, you know, is there something we could just do here? Is there something we could do just about the filing and the systems and how we work to make sure that really, really interesting piece of work that I, from the outside, thought had been very influential, didn't just get lost in a filing cabinet. And so I got very interested in how we understand this journey of research into policy and practice, and I'm not sure I understand that a lot better than I did then. And the kind of pivotal moment for me, I did my PhD on how youth mentoring work was used in education policy. And I was working with Ray Pawson, who had very good connections with the Department for Education at the time. And we would go in and talk to them about our research, and they were lovely. And then the green paper came out on youth mentoring. There was no mention of any of our work. And I was really disappointed because I was tracking impact. And so we were going down in the lift at the end, and I said to the person, very lowly person who's tasked with taking you to the lift, you know, such a shame about being, you know, because we did all that. And he said, yeah, your diagram was in the next to last version of the green paper. It had a whole page, but we had to cut it at the last minute because we had some other stuff to get on. And so we were so close to our research having visible impact. And it had influenced the conversation, but there was no visible sign of that. So that journey took me back, I guess, into the research world to think about, and I've spent the last 20 years and then thinking and researching and understanding as well as I can how we can make the most of the research we do for all the different people it's meant to benefit.
Great,
Yeah.
Thank you. I'm wondering whether we could pursue that impact theme for a little bit. There are different kinds of impact. Is a citation in a government document really impact, or is changing the framing of the discussion an impact? Can you say a little bit about that? Do you think impact is something we can actually aspire to? Or?
I think we can definitely aspire to impact. Whether we can aspire to capture it in measures is the challenge. We've just done a big consultation exercise as part of my government job, and the one thing people come back to us and say, you know, thank you, you know, for this opportunity, and we've been really engaged with government, but we want to know what happened to our piece of research, where our piece of research has had an impact on policy. And actually, I can't, even from within government, I can't give them that answer because I know where it went, but what happened to it and how it melded, as Nick mentioned earlier, with other forms of evidence. And that's entirely as it should be, but that then capturing what your piece of evidence. So I think it is about changing our framing about what it means to make a difference, that we are contributing, we're putting something into a larger pool of different types of evidence, different perspectives, different knowledge, and that's all for the good. But that kind of pull back to show what one piece of work that we've been working on, where that trails, and I think that's that's not a fruitful place to put our energy.
But can we avoid it in an era of ref? Should we should rebel? And
well, we
say
can
we're
write
not
very
going
nice
to play
accounts
that
of what we
game?
think we can do, yeah. That's what people do.
Okay.
You carry on doing that.
We need to do that performance whilst
It's
not
a performance, but
believing in it.
I do think we've also learnt a lot from doing it, actually, from trying to evidence and trying to understand what it means for research to make a difference. I think we've learnt from that journey, and that's been a good thing.
Okay, thank you. We should have said it, or I should have said at the beginning, if you want to ask a question at any point, feel free. Otherwise, Annette and I will just gossip for the next hour, and that may or may not be interesting to listen to. So I think just try and catch our eye, and we'll pause. And I think there are roving mics. But if you don't wave at us, we'll just carry on rabbiting away, I think. Is that okay? You mentioned your role in Department of Health, but then more recently in government. Can we hear a bit about that?
Yeah. So in December 2019, I went to work in the Government Office for Science, which is the part of government that oversees SAGE and all the emergency secretariats. So little did we know in December 2019, when we entered this really lovely government department, that it was going to quadruple in size and become this very media-focused place to work. And what we were working on throughout that period was the kind of what we were calling kind of research for the COVID recovery. So we weren't engaged with we were the non-SAGE side of the department. And aside from the fact that in government there is better cake, shorter meetings, and better management, it's been a real eye-opener about how much integrity there is really within the civil service and how much effort there is to try and steer policy and try and find ways for research to be used. And that those opportunities for us to move between environments and see what it's like to be doing policy work or to be doing practice are so important for those of us who primarily do research, to understand what it means for where your research lands and how people are thinking and using it and what it means to present it in a way that they can engage with. So that's all been good. The work we've been doing is each government department has to articulate now and publish its areas of research interest, to say what they want to know about in terms of research. And what our work's been doing is about trying to mobilise those areas of research interest so that they are useful and usable for the research community, for the funding community, and perhaps most interestingly, that we hadn't anticipated, for the cross-cutting issues that governments are interested in, actually for those people here who work in health. Nearly every government department identifies research questions that are to do with health, whether it's from a transport perspective or a pensions or a benefits perspective. And so those trying to connect up really those government agendas a bit more clearly. So that's been really interesting.
Simon and I were talking about this just while I should have been up here getting mic'd up. But do you want to come in on that one, Simon? We were talking about nearly every problem is a cross-cutting, complex problem. How do we respond to that as evidence providers?
I'm really interested, having worked across all these different organisations and tried to cross those sort of policy or often silos, what have you found works in terms of ways of working or the setting up of systems and structures? And do you have different challenges in different areas or different organisations?
Yeah, so we've just done a big exercise getting people to talk across particularly different disciplines, but also different kind of problem framing. And actually it just takes a bit of setup work and an explicit acknowledgement that we look at problems in different ways. And then people find it really interesting. So it's really interesting for someone who works on local authority housing to talk to somebody who is interested in architecture and the built environment. But it does need a bit of work and facilitation to help that happen. And so it's not something, just putting people in a room is not enough. But I think having those conversations is really stimulating for people from different disciplines and angles, if they've got that help to talk to each other really. So it's a little bit about the language we use, but also how we see problems and how we see, and what the solutions look like in our world, which are often very different. So I think it's stimulating stuff with a bit of help. Yeah.
And I'm now realising I should have asked Simon to introduce himself just because I knew him. That was a mistake. But let's do that from now on, shall we? Yeah.
Well, Simon Murphy, I'm Director at Decipher, one of the Healthcare Research Wales funded
Thanks.
centres.
And I know Kieran's got a question, but I'm just disturbed at your revelation that you were in government during the pandemic eating cake.
Yeah.
But
yes.
We'll move
on my own, though.
Oh. Kieran, have you...
Kieran Walsh from Healthcare Research Wales. In the UK, we have a very strong institutional separation, both between politicians and civil servants. You know, our civil service largely stays the same when we have political transitions, and also between the civil service and academia. It's not very common to do what you're doing and go from academia into the civil service. It's even harder to go perhaps the other way. Yeah. And I'm just contrasting that internationally, most obviously with America, for example, where because there's a large number of political appointees, it's quite common for academics to move into government when there's a transition, a change of administration, a change of political control, and quite common for them then to retreat back into academia when it changes again. I just wondered if you had any thoughts about why it is we don't encourage that shift, and having done it yourself, what we could do to make it easier, if you think it's a good thing to have these people who bang back and forth between the two worlds and hopefully understand both worlds.
Thank you, Kieran.
So I think it is a good thing to do. One of the things I think we're not sure from the current evidence is how much intensity there needs to be for that. So maybe spending a day in a care home when you do social care research is going to help you be a better social care researcher. You don't need to go for a year. And maybe in government you might need to spend a week. So I think that the level of intensity of how much you need to move around the system, and certainly our civil service colleagues are very keen to have people in from outside. There's lots and lots of small package bits of work they've got and they don't have enough people to do it. So there's lots of demand for that, and the systems are different in different departments, often about security. So, but there is a scope for that. There's not so much support for people coming the other way. And I think that is a shame that there isn't those same incentives and actually that feeling of like, I'm not letting someone go because they might not come back. And so that sense that you want people to be coming in and out, yeah, I think there is a positive, but it's not, and it's not for everyone. So there'll be people who do that, but people who kind of stay where they are as well. And we shouldn't, yeah. My worry with the idea of fellowships and exchanges is it's become the thing. And we always think in knowledge mobilization there will be one solution. So in the States at the moment, it's all about research practice partnerships. The only way to change things is for us all to work in these new partnership forms. Here, it's all about fellowships. And actually, what we know is that if you're going to have more knowledge mobilization, as Lisa and Reb talked about their social care Wales work earlier, you need a strategy and lots of different techniques and approaches, and you need to be doing all of those things. And at the same time, you need to still be putting out your research in journals and doing blogs and all that. You know, there's a lot to do. So that does worry me about the exchanges and fellowships. It seems to be the latest thing we've gleefully fallen on as the thing that will solve the problem.
Yeah. I mean, come to your question in a sec. I worry a bit that what we'll do is cultivate some individuals who become very effective boundary spanners, but they're still operating in the same systems that constrain their ability actually to use evidence wherever they are. Is that just my bias? Or
and we did a study a few years ago of people who'd had NHR investment in their career in healthcare, and they talk about like a whole range of resistance they had going back into their NHS roles. They had resistance from their teams who said, well, you've had some time out, get back to work. And their managers who said, don't ask her to do this again because I've been covering for you. And the organisation that said, I don't want to learn from you, I want you to get back to work. You know, so the system isn't really absorbing their skills, but they as individuals are growing. Yeah. So that's the problem at the moment.
Thank you. There's a question right at the back.
Hello, Janet Messer from the Health Research Authority. Really interesting to think about that sharing of knowledge and understanding. But is there anything around suspicion from the public? So we know that there can be times when government-funded or government-commissioned research is regarded quite suspiciously by the public, and the research, therefore, it doesn't gain the same traction. Are there ways in which we can mitigate against that, or ways in which we handle that?
This is one of the things I think that's been most interesting, moving around different government departments and different areas of policy, because this idea of kind of trust in government, which is lower than it ever was, is different for different departmental areas of responsibility. For the Home Office, for example, you know, in terms of their research portfolio, are rather nervous about what they put out as their research agenda. So it does differ depending on, and also within health, on the bits of health that you do. I think though, trust in scientists seems to have continued to rise. So, and that is part of our responsibility, that people do trust independent academic research as a source of knowledge. And so how we hold on to where that comes from and why that's the case is important for the sort of knowledge that we produce.
Yeah, and there's a colleague right in front there.
Yeah, my name's Anthony Cope. I'm a PPI volunteer. I was slightly shocked when you said that research can just end up in the bottom of a drawer. So my thought was, how do you get that? How do you stop that from happening? Or are there certain gatekeepers that need to be got through? And at the end of the day, is it on the whim of a minister at the end of the day as to what actually is implemented?
I think
know
so.
It's a big question.
No, it's a good. So when I found this research in a filing cabinet, this was in 2000, and I don't think it would happen in the same way now. So at that point, you know, you put your, it's hard to imagine, you put your research, your pile of reports in an envelope, and you took them to the post office, and you sent them to the department. We used to have to go down to the post office to pick up people's submitted either end of grant reports or their publications. And now there are so many ways that we can share our research that, and you know, we're not relying on that kind of very linear route that we produce a report and send it in and it will be shared, that we, you know, and there's an expectation that we will be sharing that research as we go along and in lots of different formats. So hopefully that wouldn't happen now, although there are still filing cabinets in the Department of Health, so there's something in them.
We talk a lot about demand-led evidence mobilisation, and I think if something's ended up in a drawer, it's possibly because it's got lost, but it may be that nobody wanted it in the first place. So there's something, I think, about understanding the demand that's there, but also creating the demand for the research that you know is available or which you want to produce.
And also that kind of timeliness that research can often take too long. And so when it is, so this may have been wanted when it was commissioned, but not necessarily wanted when it was submitted. Yep. And at the start of the day, there was somebody talked about research needing to be nimble, and something we'd learned from the pandemic was to be more nimble with our research. And a number of people have mentioned that through the day, how they've, learned to do things quicker when needed, not all the time. And that's an important learning point we've had, I think, about how we can step up sometimes and do things much more rapidly.
Yeah. It's a bit of a killer presenting evidence to a minister who her predecessor asked for, isn't it? And I've had that experience. It's not a good gig. I might come back to this in a minute, but let's take this question.
Hello, thank you. Andrea Tales from CADA. Can I ask your opinion about REF, especially in terms of those as a university doing research, good or bad, for research itself and for its dissemination and impact?
Yeah. Should we say a little bit about what REF is, or does everyone? Yeah.
So REF is the way the UK allocates funding to universities. So it's called the Research Excellence Framework, and it's an assessment, like all the assessments we're all subject to, of research performance, and it will distinguish who gets a lot of money and who gets less. It's good and bad. It's bad in my eyes because its framing of impact is simplistic and is single, most of us spend our time saying it's all about synthesis and what we know already, not about single studies, and here we have a single study-based setup. And it's good in that it's raised literacy across the UK, and you see that when you go to other countries. We can have this conversation now in universities that we couldn't before, so a bit of both. Do you agree, or is it all bad?
No, I absolutely agree. Yeah, personally, it's been a godsend because I spend my time trying to encourage academic researchers to apply their evidence to questions which we're being asked by ministers and public services in Wales. So it's a very, very useful lever for those of us who want to see evidence used in policy and practice to say to our academic colleagues, hey, come on, you're going to have some fun, but you're also going to tick a box in this process. So I like REF for that reason. I think the model of evidence use that seems to underpin it is ridiculous for the reasons that Annette has said. But please.
Roger Seddon, Health Impact Assessment Researcher. I've got perhaps a provocative question. Do you think fashion dictates the reception of research on our ministers' desks? I'm thinking that over the last couple of years there's been a growth in social research laboratories throughout the country. I think they've reached their apogee with Michael O'Leary's sponsoring of the SDG lab at Oxford. But do you think fashion plays a part in dictating or perhaps complementing your strategy to make sure your research comes at the right time to the right person?
That's a great question.
Yeah.
For me, what's more than fashion is framing. So I think our framing changes, and that's what distinguishes certain research being. So, for example, we're here talking about health and social care, but most of the time we're talking about health, because the framing of health and social care is still predominantly about health, and that framing still needs to shift. You go into other areas of policy, and so say during the pandemic, we talk about the impact of research during the pandemic. We actually mean the impact of epidemiology and modelling during the pandemic, but the rest of us go on the coattails of that with all our research contributions. So framing is so important, what we mean with the words that we say. I think fashion does come into it. So, for example, behavioural science is super fashionable at the moment. That came from the US, this idea. It's all about, the tax man reminding you that you've got to pay, and those little reminders matter. So that's very big in government at the moment. So there is a bit of that. But for me, the bigger thing is how we shift framing so that it really fits with the concerns that we're facing.
Thank you. Can I take you back to the quote? discussion we were just having about agility and research being available at the time when potential users of research in policy or practice would want it. And I've heard you say something along the lines of, we don't need more research, we don't need more evidence synthesis. Maybe a difficult thing to say in an audience who are partly researchers, but what we do need is to be much smarter at using the evidence we've already got. Is that, am I misquoting you, or is that?
No, I think there's so much research out there, and when we have new students start and they tell you their topic, and you say, if you go away and look, you'll find that, there might be quite a lot out there already, and people are always shocked by how much there is on what they think is a kind of completely novel area they've found. And that, from a practice and a policy perspective, that's really brilliant news, because it means in almost anything we're departing on, there will be some research out there that we can draw on. And what we need is to have those spaces to have conversations about how that fits our context and our services and our service users. That's the spaces that are missing, which is the sort of work that Steve does with the Welsh Assembly, giving people some space to talk through, well, what does this mean for us? And do we actually need a bit more additional research or not? So that feels like a really important place, and we are constantly pulled back to commissioning more research, which comes with all these issues about having to wait for that research to actually be done and to be ready to be shared. So I think doesn't mean we know everything, but there's so much we know, and we're always tempted to go out and buy brand new rather than recycling.
Do you think we're getting better at that, or are things as bad
No,
as they were 20 years ago?
Maybe a bit better. I'm an optimist.
Okay.
We spend more on synthesis than we have done, so it's a slightly bigger part of the research funding portfolio, I think. Maybe not.
Is there another question? Yeah.
Hi, I'm from Health Technology Wales. I just wanted to ask you, given kind of the focus that we've had today on person-centred, more kind of care-focused research, given that it's much harder to kind of accurately assess impact in terms of, numbers and quantitative data that we kind of like from a government perspective, do you think that there are two prongs, I suppose? Do you think that there is a hesitancy in a policy sense to kind of take on this research and be more receptive and open to this research? And if there are these hurdles, what do you kind of think that they look like? Does that make sense?
Oh, I didn't quite get it, so you start.
Well, Annette's the expert in this, so I'm just buying a little bit of time. But I think there is a receptiveness to it amongst the policymakers who we work with, anyway. And I think people's stories and accounts are extremely powerful. They're not actually the kind of evidence that the centre that I'm part of generally deals with. But I think ministers are enormously swayed by what somebody said to them at the surgery in their constituency the previous week. And quite often, actually, in our discussions with them, are asking us, I've been told this 4 times now in the last 2 months. Is there any evidence which can back that up or help to explain it a bit more? So I'm not operating in the health and care world, so I'm treading carefully, but I think that for most policymakers, a person-centred approach is actually very meaningful.
Yeah, I mean, it's one of the things I think is important about the kind of prioritisation space and why things like the James Lind Alliance are so important. That actually, what we know is that different stakeholders have very different research priorities, and what we need is to be able to give them space to negotiate and discuss those together and work out what really are the important questions, some of which will be just patients' questions and people who are using services questions, and some will just be policy questions, and some will be shared questions. But a lot of the time in kind of government discussions, that voice of kind of people who are using services or even delivering services gets a bit lost because there are so many stakeholders across government to think about. So I think how we bring everyone's perspective together when we set priorities feels to me like, certainly in our work, we've identified as something we want to do more and understand more. And there are people who do that and have clear, transparent processes for thinking about prioritisation.
There's kind of no escape from COVID, I think, in talking about some of this. So two points to do with COVID. One was, you said we've kind of got too much research, and there is research on kind of everything. One of the things we've discovered, I think, in the pandemic was we were really well prepared with our research base on some things.
Yeah.
Vaccines, the epidemiology, the modelling, lots of work. And yet we didn't know much about aerosol transmission, the effectiveness of face masks, transmission in workplace settings. And there were a bunch of problems which I think we might regard as boring but important, that the research community, for whatever reason, you might like to comment on why, hadn't really mobilised around. And I wonder if there's a lesson for us about how we organise the priority setting to see those boring but important things addressed. Connected to that, in my experience, having been a research funder for quite a long time, is the people who are always in the room, in the room where it happens, are the research community. So the people who come to your workshops, the people who turn up, people who are exercised will come to your, and that's how the agenda gets shaped. So if I give another COVID example, if you look at UKRI's rolling programme, there's a lot of research in there, quite interesting, quite important, but whether it was the necessary stuff is another question, because somebody who had spent their career researching homeless people wanted to do a project on the impact of COVID on the homeless. Important questions. And the converse of that, which has emerged, is the idea of a mission-based approach to research commissioning, where you say, well, no, we will take the problem, we will break it down, we will analyse it, and we won't let the research community set the agenda, we'll have mission-driven research. So I wanted you to comment on that issue of research gaps, but also whether we should think about prioritisation being much more driven by the agenda of the people who are going to use the research.
Yeah, and I think the issue of funding definitely is an area that probably needs a shake-up. It's interesting, the British Academy have just put out some funding that they're going to fund on a kind of lottery basis. So, and they reckon that might be as good as, because the processes get so captured by certain vested interests. So I think thinking again about how we spend the money we have, particularly when it's in short supply, and spending more of it on synthesis and things like that seems really important. I think this issue about what you draw in when you need it. So one of the things that struck me during the pandemic, where I am, we have lots of anthropologists, and they were there saying, we do know quite a lot about pandemics, and they might as well not, we know about pandemics. We spend all our time, we've got stuff from Ebola, we can tell you about how communities respond, what we can do to help with that, how we can deal with fear, how we can deal with school, so it's also, there are the bits that people don't research, and then there's the research we recognise when the time, and how creative we are and how interdisciplinary we are when we do that thinking. I thought that was really interesting, how some people can be shouting very loud and people can't hear them. So how we go into those to really make the most of what we've got already to when we face these. And then I guess the other thing linked to that is the importance of kind of foresight and horizon scanning. So the government was ready for a pandemic, they just weren't ready for a pandemic like that one of something that they didn't know anything about. And so, we do have an infrastructure of readiness for all kinds of problems that are going to come along, and that's a really interesting part of the research community, people who help you prepare for things that are going to come along and be disasters. So yeah, the research plays into the picture in so many ways, and we spent a lot of time thinking, as you say, about one particular subgroup which we must see as successes, because a lot of them are about significant investment over a long time and building infrastructure and relationships to be able to be mobilised really quickly. So that is really good, but then there's all the other things that we maybe just didn't spot that we could also have used as well.
I wanted to ask you a bit about ARIs, areas of research interest.
We're going to ask about AI.
No. Oh, well, we can, if you know anything about that. Because I think it sort of links. I've always wondered whose areas of research interest they are. They seem like a step forward. We've been slow to adopt them in Wales. Yeah. But are they actually? Are they leading to a more demand-oriented type of research and evidence? Or is it a bunch of government social researchers, in fact, dreaming up those areas of research interest?
No, so areas of research interest are, so they are done, they're quite UK focused, but the Americans have tried this in the past. So the idea just is a bit more transparency about what your agenda is. And it is the agenda you're prepared to share outside. So if you're defence or you're the Home Office, it's not your whole agenda, it's what you're prepared to share publicly. But what it has done is allow government analysts to make better relationships with policy teams to negotiate what it is that they're interested in. So there's some internal learning there. And then to talk to other departments about, oh, you're interested in that and we're interested in that. So there's some interesting learning there. It's not the whole picture, and there are big gaps because of the things that governments aren't prepared to articulate externally. But it has helped, and linking to department science strategies to help them think and have a kind of a view of how they want to work and what they need to do and what capacity they need to build. Because after all, for our research to be useful, we need capacity within government and within local government and within practice contexts to be able to use that and find useful that research, to do things differently.
Do you think it could be adopted at local level?
So the Greater London Authority is just doing its areas of research interest. All the parliamentary select committees produce them now, which I think is a really interesting use as well. So they are being adopted in sort of local government as well.
I was thinking, Kieran, one of the groups that it seems to me didn't come out well from the handling of the COVID pandemic was perhaps the behavioural insights gang that Annette alluded to, who were all telling ministers apparently that we wouldn't comply, whereas in fact we were much more scared than they'd bargained for. So maybe we learnt some things about what we don't know and some things about what we do know and some things about what we thought we knew which we don't actually. My research interviews always end with, what should I have asked you that I haven't done? So I'm going to give you the last word. Is there anything that you would want to share with this august audience that we haven't done?
So I think the thing that I've picked up, a few things today which I've found really interesting, I'm going to take away. I think a plea to the research community is always, and Nick just did a brilliant presentation about this, is about being more creative or using creativity. I mean, we are the masters of turning everything into the dullest report you're ever going to read. So we get tested on that as part of the process of becoming a researcher. And actually, if we're going to engage and have conversations, we need creative ways of presenting research so that we can have those conversations. I remember the first time when we were at Warwick, actually, and I ran a workshop for older people around our research, and someone put their hand up at the end and said, I've had a nice day, but I really was expecting to make something. And I said, well, I was expecting to sit around talking all day, so I met my objective. So that if we're really going to get research to be more useful in policy and practice, we need to pull ourselves away from this idea that research can only be presented in lots and lots of text. And then I think there is so much more potential for research to be useful and used for policy and practice. We always say, oh, it's about the patients and the service users, they need it in that format, but we all need things to be in an engaging format to really find it useful.
So we're on the hunt for a PhD presented through the medium of dance, or?
Yeah, and actually Kieran will do a fire dance for us, yeah.
Great. I want to ask you to thank Annette ever such a lot for sharing 20 years of wisdom with us in an hour. Thank you.